common complaints with which patients present to us in the ophthalmology clinic could be blurring of vision, central scotoma, that is, seeing something dark in the central field of vision, some objects floating in their field of view called floaters, or even worse, the total loss of vision. Eye is a very sensitive organ in the body which functions like a camera, and the neurosensitive structure inside the eye is called retina, which is like the film roll in the camera. We are able to see this beautiful world with our eyes because of this sensitive structure called retina. Examination of the retina is like opening a Pandora's box. How does a normal healthy retina appear? It appears pinkish with a yellow disc or a spot, that is the optic nerve, which is a nerve connecting eye to the brain, the healthy looking vessels, and the most sensitive area of the retina, that is the macula. Many systemic diseases that affect our body can show changes even in the retina. One of the most common systemic conditions we see today is diabetes mellitus. Every third patient we see in our clinic is a diabetic, and diabetes is one disease that affects almost all structures in the body, and one of the most common site of involvement is retina. When it affects the eye, it is called diabetic retinopathy. There has been more than 50% increase in the number of diabetes patients since last 25 years, and thus the prevalence of diabetic retinopathy has also shown increase to more than 20%. Changes of diabetic retinopathy goes unnoticed in the early stages of the disease. Diabetes can affect the eye in two ways. It is called retinopathy when major part of the retina is involved, which happens in multiple stages, starting from mild to moderate to severe to the late stages, that is a proliferative stage. And in the very late stage, it can reach to a condition called high risk proliferative diabetic retinopathy or tractional retinal detachments. Vision may not be affected in the early stages of the retinopathy, but blindness can happen in the late stages. Another entity is called maculopathy, wherein fluid accumulates in the area which is very sensitive for vision called macula. This causes blurring of vision. Every diabetic is a potential candidate for the development of diabetic retinopathy. 80% of diabetics need only follow-up and management of systemic risk factors. It's only the rest 20% who may need active intervention by eye specialists. As it is symptomless, all patients with diabetes need to undergo regular eye examination. As per the ADA guidelines, in patients with type 1 diabetes, first screening must be done within 5 years of the diagnosis of the condition, and in type 2 diabetes shortly after the first diagnosis of diabetes. If retinopathy is diagnosed, based on the staging of the disease, further follow-up will be advised. Thus, all diabetics need to undergo regular eye examination, which includes a dilated fundus examination wherein special instruments are used to examine the retina after dilating the pupil. In advanced stages of the disease, laser treatment may be needed to prevent further progression of the condition. Intravitreal injections into the eye may be needed in conditions of maculopathy and some stages of retinopathy. And severe advanced cases, surgical intervention may be needed. Is treatment of diabetic retinopathy a challenge? Patient may need multiple clinical visits. The treatment done for advanced diabetic disease may not be for a complete cure, but only to control the further worsening of the condition. Patient may need complex surgical interventions, and the outcome may be unpredictable based on the extent of the disease. The surgical treatment could be expensive, it may be hard to convince the patient, and this may lead to poor patient compliance. As the saying goes, prevention is better than cure. Thus, the aim and the goal is to prevent the onset of complications. How can it be done? By early detection and proper comprehensive management of each and every diabetic patient. As there are no symptoms, more patients are approaching the ophthalmologist in the late advanced stages of the disease, which can lead to blindness. Thus, our aim is to reduce this by encouraging our patients to undergo periodic eye examination by ophthalmologist and undergo screening for diabetic retinopathy at regular intervals as advised by the ophthalmologist. By this, we should be able to prevent blindness in our patients resulting from advanced stages of the disease. Department of Ophthalmology at Yenepoya Medical College and Hospital, since its time of inception, has been actively involved in this direction. Retina Clinic in the hospital offers screening programs for all outpatient and inpatient diabetics. Counseling sessions are being carried out regularly regarding the regular periodic follow-up for these patients, and treatment for advanced disease in the form of laser therapy, intravitreal injections and surgical interventions are being provided at reasonable prices.